Thank you so much for joining me today, guys. I really appreciate it. And for myself, I'm Kevin Kunzman, managing editor of HCP Live. And if you're watching this right now, this is sort of special video conference interview, pretty unique to what we do standard as response to the COVID-19 pandemic. Obviously, we've been doing a lot of virtual one-on-one interviews on topics pertinent to health right now. And obviously, the pandemic and the nature of how it's affected not only the healthcare system, but how we operate as a whole every single day has been very influential in these discussions. And these gentlemen with the Heart House and Gomo Health today are with us to talk a little bit about, first and foremost, concierge medicine, and second off, exactly our responses in terms of still providing individualized cardiac care during the pandemic. So first and foremost, guys, if we wanted to talk a little bit more about your guys' work in concierge medicine, can you give us an idea of exactly what it looks like in your region of care? How many patients are privy to this? Is there a certain unique population of patients that are interested?
Yeah, so this is Bob. I'll just start out. So before COVID, the Heart House specializes in cardiology, really wanted to extend the point of care to provide precision and individualized health and population health to folks outside their four walls. So really, they got into telehealth prior to the whole epidemic and COVID. And since then, Heart House has added a few special programs that they'll talk about relating to COVID. But the idea is there's a remote patient engagement program, the Heart House Personal Concierge, which would be called a digital therapeutic that engages heart failure patients in their daily life, addressing their behavioral issues, their physical issues, and interacting with them. In the tech world, it'd be called a bot, right? But it's really learning about them, engaging them, and then when it discovers something that could be an adverse event, like swelling of the extremities, shortness of breath, it escalates to the Heart House clinical care nursing team to handle. So, and in addition to that, they have a bunch of other telehealth programs that have shown to collectively reduce readmissions, reduce ED visits, increase patient satisfaction, and really enable both the patient and the clinician to be a little bit more in harmony, when they get together and through the health journey. So I think that's sort of setting the stage. And Sandy or Josh, maybe you can just kind of deepen that a little bit.
I think that, we got introduced to Gomo Health. Actually, Bob and I met when we were at the famous Bell Labs headquarters, I think. So the beginning of this was how can we use technology to improve healthcare in our communications with our patients. It's easy, I see my patient now, it's getting harder and harder to see patients in person. And even when you see them in person, you get to spend 15 minutes with them. So I think it's becoming more and more important for you to get insight into your patients and have an ability to communicate with your patients in a manner that is not disruptive to the patient and to you. And to me, the text messaging, mobile phone platform seemed ideal. And it's something that we call that Bob and I, refer to as patient engagement. So it's a way for us to get information on our patients that can help in their care, and also simultaneously make the patients feel like they're engaged with their providers in a way, again, that's not disruptive to either of us. In an ideal world, it can be used as a research tool as well. And it also is a way to sort of head off problems before they become a problem. And that's what's most important, particularly in multiple cardiac conditions like congestive heart failure and atrial fibrillation, where you can find out early on if the patients haven't filled their prescriptions. And if they haven't filled their prescriptions, is it because they can't afford them? Did they just not get to the pharmacy? Did their insurance company refuse to pay for the prescription? Those kind of things, which if you're not aware of them, can turn into problems relatively quickly, are something that we can address through our partnership with Gomo Health. So we like it because it heads problems off at the pass, gives us early warnings when patients are getting into trouble. The patients love it because they're getting communication from their doctor, and it gives them a sense that our practice is much more engaged with them, is concerned for their health, and that's a feeling of warmth that's hard to communicate when you just have a 15-minute office visit. Our staff is terrific, but to get that feeling that you're quote unquote like family, more communication is important. And I feel that this is a way to communicate again with a minimal providing the most information with the least amount of disruption to patients and providers' day-to-day lives. Josh?
Yeah, so I think that, as Dr. Gipp said, the communication is probably the most important thing to really be successful in providing your patients access to care, and to provide them and make sure that they attend their appointments and get feedback, results of their tests. And so we have a platform that we utilize to engage technology to do our best to communicate as much as we can with our patients. We think it's very important to gauge patient satisfaction. So every patient that comes to our doors gets a text message and asks them pointed questions about how their visit was, how it was in terms of access to get to their doctor, the communication with their doctor. And we use that data to go back and assess how can we do things better. We also have certain reminders that we put into place to remind patients that, hey, don't forget you have a study coming. We want you to make sure you're attend. There are certain studies that we do where patients can't have caffeine before their study because it'll affect the study and the results that they get from trying to study the heart. So we have a morning of reminder that says, hey, we can't wait to see you, Mr. Smith. Don't forget, don't have your cup of coffee this morning, because drinking coffee is so habitual for a lot of people. So we send them that reminder text message. For results of ultrasound studies. If it's just a notification that, hey, everything's going great with your heart, we send a text message and allow that communication to be read on the patients on when they have time. And with the whole COVID situation that we're dealing with right now, it's very important for us to make sure that our staff, our clinicians, and the other patients are safe. So we have to do our best to assess whether our patients who were reminding of an appointment have had any interactions with other people who have COVID, had tested for COVID, whether they have had any flu-like symptoms, whether they've traveled outside of the state of New Jersey to one of the multiple states that's on the list. And we're utilizing the platform supplied by Gomo to assess that information. We do that. The text goes out at nighttime, several days before the appointment. We get those results the next day, and then we can act on that. And any patient who has a positive response to any of those questions, we can then reach out to, and we can figure out whether we need to transition their visit from an in-person visit to a virtual visit, whether we need to reschedule their visit for another point in time. And so it's an entire platform that we're utilizing in order to best communicate with the patients at a time that's convenient for them.
Just to add to some of that, just some fascinating data for you. So we talked about a number of programs we're doing. In the heart failure program, particularly, there's about 1,000, close to about 1,000 participants. We've had 500 in the last year, 562 escalations based on swelling of the extremities, weight gain, non-taking of meds, and 362 of those are unique. So that means a few people had multiple. And because of that, participants in the program, we've reduced readmissions from about 22% to 9%, right? And we've reduced ED visits significantly, because the idea in what Josh and Sandy said, they're learning about people, they have a dashboard, the nurses get pinged, they're able to communicate, and sometimes it's not an emergency situation, the nurse is just explaining to people and reinforcing it. And to Sandy's point, whether you do a televideo visit or an in-person visit, you only have so much time. And for example, the people in the heart failure program, the digital therapeutic also addresses the 3 top comorbidities of smoking, diabetes, and renal. So it's actually, which, you know, the clinicians don't have as much time to sit for hours with the folks. And even if they do, it needs to be reinforced when you go into your lived environment. So really what they're doing is transitioning the point of care, not only from their 4 walls, but into the home.